always down and out about their haircuts.
I'm begging anybody out there, before you go and get surgery, before you walk into these hair clubs to someplace, I'm telling you right now, I am $20,000 in the hole, and 10 years of stress, the last 3, an absolutely horrifying existence of stress and pain. And I can promise you, the stress of this hairpiece is 1,000 times more than I would have ever felt if I had just been confident with who I am, dealt with the fact that these are the cards I've been dealt, and deal with them, and just shave my head. And honestly, like Spencer said, not everyone's there, but that's where I'm at.
And now something completely different.
Good afternoon. I'm speaking to you live just outside
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
Hey guys, welcome to the show. 888-659-3727 is the toll-free number, as usual. Also, if you guys want to, is there any feedback? Call in to the UK line. The UK line is, if you're watching Joe Tillman's page, you see it on Joe Tillman's page, but I'll give it out to all of you who might be listening in their cars in the UK. It's 0203-3724-683. That's 0203-3724-683. We are the hair loss guys. And I've been doing this for a really, really, really long time. Way too long. I am a consumer advocate for men and women dealing with hair loss. I'm the author of The Bald Truth and the Truth About Women's Hair Loss. I am the founder of the American Hair Loss Association and the International Alliance of Hair Restoration Surgeons. And I have been doing this broadcast. We are going into our 20th year of broadcasting. Started on WABC in New York City, was shortly syndicated nationally through Westwood One Radio Networks, and then onto XM Satellite Radio. And now we are exclusively online, being syndicated to the Guys from Queens Network, iHeartRadio, Stitcher Radio, iTunes Radio, now Joe Tillman's personal hair transplant mentor YouTube page, which is youtube.com/hair transplant mentor for those of you who are listening. Now, I noticed it seems that we get a lot of our calls from the viewership, from Joe's viewership, which is great. I know that I've listened to probably hundreds of thousands of hours of radio and never picked up to call a radio show. So I understand that. But for those of you who are in your car, who are listening, wherever you are, through your Bluetooth devices, on your phones, through your in line or whatever it's called. What are the Apple systems in phones now, in cars now?
Apple would be
Apple Play.
Apple Play, and then Android would be Android Play.
Yeah, if you're listening to through whether it's on TuneIn or whether it's on Stitcher or whether it's on the Guys from Queens Network, or if you're watching us via Roku, call in, let us know.
Roku.
Yeah. Let us know. We're recently, it's funny, I was just contacted by a marketing firm, an online marketing firm. And, they wanted to know the number of downloads and stuff like that. And I'm like, yeah, I'll absolutely give you those stats, but you do know that I can't promote your product. And so I give them the numbers, and I'm like, it's all verifiable. And they make me the offer. And I'm like, that's not bad for, offering somebody's podcast some money, because these guys really they make low fucking offers. And then it's like, you got to do a tell them that you heard about them on the Ball of Truth, the access code or whatever code, so and so. I'm like, yeah, I'm not going to do that for $4,000 a week, and that's a big offer for
it is
for the internet. But it's like I'm not selling your product. And it's a questionable product, meaning that it's kind of on a line. It's like it's on that razor's edge where I could probably be okay with it.
I'm running. It's running through my head. Like, what could it have been?
Yeah, I can.
What product?
I can probably be okay with it, and no one would be harmed, and some people might be helped. But, and it's that's $12,000 a month. I'm not saying that would last a long time, because then it's like, oh, we only got these many leads, or those many leads, or these many sales, or.
Sorry. You said how much?
$12,000 a month.
But you said it was $4,000 a week.
I'm sorry, $16,000 a month. Right.
My math was.
Oh shit!
Okay, yeah.
Let me get back to these motherfuckers.
It's
more than I thought.
Maybe you should get back to them.
But what it definitely shows is that people are watching, people are listening. This particular firm did not find us through Joe's page, which is unusual, but found us directly through a search trying to find a hair loss podcast. And then
they
wound
up finding the hair loss podcast.
Yeah, and then learning about the American Hair Loss Association, learning about me and all that stuff. And when they put two and two together, they realized that, this is the situation. We will make in this offer. We could always pull it. They only want to do 13 weeks at a time, just like radio.
Yeah.
So I'm just like, you know what? I'm not interested. If you want to support our message and underwrite the program, great.
My issue on this is simple. I was approached by I was telling you about this one product that approached me, and they wanted to, promo code and all this stuff, but then part of the deal was there's also a flat fee for the video I would make, and in order for this to work out, they said they would have to have access to the video. They have to own the video, and it would have to stand out there for 5 years.
Wow!
And I thought that's a really small amount of money for something to be out there for so long.
Yeah.
But the other thing I thought about is for a broadcaster in the internet where everything's on YouTube or Vimeo or wherever. Once it's made, it's there forever. It's not like you just stumble across it later on. It's like if someone goes to your channel, it's there. So once that deal is over with, if you've got these other, these products that you're endorsing, that's continued endorsement for more than 13 weeks.
It basically, for most people, it's there in perpetuity. The way that I would run things, like for instance, if I'm working with an IHS member and they want to do an interview, or if when I was consulting for the product manufacturer and they wanted to talk about their product, essentially I had in writing that, I own all the properties. And actually the properties can only be on a server I control. They can't be downloaded.
Right. They
can't be copied. And, if in fact that happens, then this, and this is stipulated in the contract. And they can never be used once I turn off those lights.
Yeah.
And that's what I did with one device manufacturer, and all I was doing was having conversations about it. And I'm just like, no, those conversations don't stay online because I am leaving the situation.
Right.
And for you to get involved in the opposite way, and that's what the small thinkers in the podcasting community, or the guys who are trying to make a quick buck, do. I'm not talking about the hair loss community. I'm just talking about podcasting and online broadcasting in general.
Right.
They go for that quick buck. They go for that, access code, whatever it is. I forgot what it's called. And
coupon code.
Either a coupon code or, yeah. And then they lose that advertiser. And then what happens is usually that advertiser will continue, especially if it's a famous voice. I know a couple of really well-known radio talent that are now doing podcasting. And then they realized that these people realized, well, okay, we monetized that. We couldn't really monetize him for that 13 weeks, but we got his ass in perpetuity.
Right.
And then they drop off.
Right.
This is much more dangerous because what happens if we find out a product is fucked up and we make the decision to leave? And then that's out there and we're endorsing a product. So I really do my best not to get involved in that. You know, since I got off the radio, my goal was never to have to fucking sell a T-shirt or a cup or fucking mugs or, you know, have ads on my broadcast and continue to do the broadcast. And we have been fortunate enough to be able to make that happen, even though this is a pretty big underwriting offer. It's unusual. Like if I were to tell my person I know with initials TL that someone just offered me $16,000 a month for an online broadcast, they would shit in their fucking pants.
Yeah, no, I'm sure. And you know what's interesting is, you know, the way that you're controlling it, it's similar to the way that I'm doing it, because I did just enter into an endorsement deal, which I will not discuss on this show, for that exact reason.
Yeah, but what you're endorsing is, I mean, that's great. It's, you know.
Yeah, but the way I'm doing it,
it's kind of shit that I use. So
I set up a specific video that's in its specific playlist, and yeah, there's a coupon code and all that good stuff. But if that ever ends, then that shit comes down. It's not going to be on my other videos, like in the videos where I'm talking about it, where there's a much larger point that I'm trying to get across in, you know, some sort of education video or, you know, whatever, because I don't want the two mixed. You know, if it's mixed, it might be a mention down below in the description or something, but it's not going to be in the video itself.
And guys, hold on, I'm going to take your call in like 30 seconds, or actually in about 45 seconds. But you know, that's very valuable to run things that way. And what I'm trying to do now is I'm trying to implore, or I'm trying to get the message out to some of the really strong people in the industry to underwrite the program in different ways. Not look at it as straight ROI. Not look at it as straight, look at the value of the investment overall for being a part of what we do. And really that value is supporting this message so that, A, you narrow the playing field of all the bad players out there, and you're highlighted as one of the good players and one of the guys that support truth in advertising. That's it. I was speaking to someone else from the field today who is having apparently a lot of problems on the East Coast. A lot of problems. They are losing their shirts, or I would say losing a lot of patients.
Losing their scrubs.
Losing a lot of patients. Now, the thing is, everyone is scrambling now because of this new turnkey model. No one knows what to do. So everyone's trying to figure out where I'm going to put my money. Let's put my money here. Let's put my money there. They're hiring marketing teams and all kinds of shit. They're being, these poor suckers, being desperate, acting out of, creating their agenda through crisis mode, are destroying their own practices and destroying, sadly, the lives of vulnerable hair loss sufferers who are never going to understand. They're putting themselves in the same category as the turnkey guy or the guy that is, doing cosmetic surgery tourism. Yeah. And everyone is now just kicking tires. That's it. All those leads that are coming in, they're just fucking kicking tires. You're wasting your time and efforts.
100%.
And sadly, you're hurting the consumer. So those doctors who are listening, listen up. Guys, phone number 888-659-3727. I just wrote a very compelling article for the International Society of Hair Restoration Surgery. Even I confuse it. Their journal. And the notes that I got back on it were amazing to me. I'm not saying I could take notes. I've been published by, many magazines. I write for Consumers Digest, WebMD. I've had my books edited to the core. I can take great line editing. I can take great notes, and I'm not vain in that aspect. But essentially what these people wanted to do is take the message out, make the message weaker for their own membership. Not, I would say, deprive their membership of the truth so that they could actually save themselves. These guys are going to be closing their doors. They got about 36 months before the real hair transplant surgeons out there are going to be forced to close their doors. And they don't even realize that. The good news is now it's kind of it's up in the air. It may be published in another journal. And then the original editor who got back to me for their journal said, well, they want to send it upstairs and see if it can go this way. And I told him, and I'm being very honest with you guys, because this will be out there for public consumption, because I spent, because I had to whittle it down to this audience, at least 20 hours trying to put this shit together. Struggling with it. It's going to be out there for public consumption and for the consumption of physicians who really need it, because you have an opportunity to save these patients who are being destroyed every day. You take it now or forever hold your peace.
Well, I have an example of part of the solution to that issue. Over 95% of male hair loss is due to male pattern baldness, which is genetic. Follicle Friday.
Jesus. Yeah.
Sorry, I had to do it. We didn't do it this past Friday, so here it is. I just had to slip that in because it really ties in perfectly.
Well,
perfect segue.
Sadly, that's a very small part of the solution, and part of the solution that could really help to better, if that type of social media nonsense and waste of time is fixed. And
redirected with a different message.
Right, and the right message is directed, then at the very least, they're going to be getting value out of the money they're spending on their social media. And they're going to be possibly helping some people. So at the very least, they're going to be able to do that. And that's got to be done pronto.
It can be done.
Absolutely. Let's take a phone call. Hey, you're on the air. Who's this, and where are you calling from?
Okay, guys, it's me, George. You haven't heard from me in a long time, from Staten Island.
All right, George.
By way of Utah.
My name is... No!
My name is... Joe from Staten Island.
My name is... Excuse me! My name is...
Would you like to reiterate it?
My name is... My name is... My name is...
Have you heard it? Excuse me.
My name is... My name is... My name is...
Joe from Staten Island.
George, what's happening, my man?
Not much, guys. Hey, Spencer. Hey, Joe. I was at the doctor
you sound like
recently.
your best friend just died or something.
Yeah.
What's going on?
I just got over a cold. I'm just getting over a cold. It's coming down into my chest. That's why I sound a little sick.
That was my second guess.
I was at my... Yeah, it's all right. The air in Utah is different from New York, so it's kind of dry. But I was at my doctor, and I was getting a checkup. Yeah, you look great. Yeah, you look great. And I said, yeah, except for I'm bald. And he goes, and this is coming from the Norwood 2 guy. He's like, I'm bald and sexy, and he's laughing. He's got this sarcastic laugh, and I just wanted to punch my doctor.
Right.
I did not, but in my head, I really fucked him up. But I didn't even give him
You played it out in your head.
I didn't even, I just left him hanging. I didn't even, he wanted a high five, and he knew he was wrong. He knew they said, oh boy, I guess I hit the wrong guy here. And I'm like, really? That's just not it. But anyway, so I've been doing a lot of massaging of my scalp. Not that I'm going to expect any hair growth back, but I do notice, guys, if you've lost considerable amount of hair, the crown and the temple peaks are gone, but you still have the forelock, and the top is still there. It's been 3 to 4 years now that I shaved my head, and that's still there. It's still fit. Mm-hmm. Is that normal, or is that going to progressively go away as well?
You may not lose it. It may just be this is your pattern. You're going to hold on to this pattern for a decade or more.
Could Could be what's it called? Baby Louie.
You got a baby Louie
That's
going.
what it looks like.
Yeah.
I've got that. I've got that going on. The sides in the back of my head that they're thick as porcupine, but just what I needed. It's just not happening there. Anything on the forefront? Have you guys heard any new developments?
There is nothing really that I believe is on the horizon anytime soon. I know that when I first opened up Joe's chat, someone was asking, let me see, what were they asking about? Replicel's RCH01 developments and what's happening in Japan.
Right.
And, if anyone doesn't know what Replicel essentially is
they're right down the street from me.
They're right down the street. I think, did you visit him, Joe?
No, I did not.
Okay,
Thought about it.
It's a cell-based therapy where this company realized that the dermal cup or the dermal sheath cup of the hair follicle was really what
you said cup
was really what would regenerate new hair. So basically, by utilizing the cells from this area of the bulb, they would then re-inject, essentially regenerate these, make new ones, almost like cloned new ones, and then re-inject them into the scalp, and voila, it appears that hair is growing.
Mm-hmm.
Now, currently, they are trying to proceed with a phase 2 trial. I think it's about 165 patients or 168 patients, and they have teamed up with a Japanese company to make this happen. There's a lot of stuff online about this coming to the market by.
Okay, come back.
Hello.
Yeah, I'm right here.
Yeah, coming to the market by 2020. It is now 2018. They haven't gotten to even though things are a little different in Japan, they haven't actually gotten to that phase 2 trial yet. It's a proposed phase 2. So let's say they make it to the phase 2 trial with that relatively small number of patients. And then they go into phase 3. And then they have to go into the following phase to get it out to market. I personally believe, and God willing, this is something that could work on a consistent basis as well for every patient who tries it. That would be incredible. I can't see this coming anywhere close to 2020. Now, I know the people at Replicel. I think, and this is not to affect their stock. This is just an opinion. I'm hoping that I'm wrong, but I just want people to know that. I want people to be realistic and not put their lives on hold waiting for these things to come to fruition.
Exactly.
Because it's very possible that once they start working on a larger clinical trial, they're going to run into different problems. Problems that they then have to go back to the drawing board and try to solve. That's a possibility.
It would be. I just kind of had an idea. It's like I've been playing around with the idea, but if any of the listeners would like to give me an idea about how they would feel about me going into Replicel to do an interview or just to talk to them, start a campaign, contact the company and say, get Joe Tillman in there. I'd be happy to take my camera with a microphone and start talking to him. I'm not going to go approach him. This is for you guys. So if you want this to happen, start talking about it.
Absolutely. And we'll do it.
I'd like that.
Joe will do it. And we could he'll run it on his channel, and we could also run some parts of it on the show.
If they'll have me.
They will.
Wow. Yeah. I was looking at this one where they were doing clinical trials in Mexico, and I'm saying, why would you do clinical trials in Mexico where the bald rate is probably a very, very small percentage?
Well, that's one way to skirt the U.S. jurisdiction, and B, they're probably not doing it on Mexicans.
Oh,
okay. So,
and one thing you got to understand is they're, contrary to popular belief, or I don't know if it's popular, but there are a lot of, I'll say, lighter-skinned, balding Mexicans than you might realize.
Absolutely. You're thinking of what you consider to be the typical Mexican, the guys that are working in the car washes and the guys that are doing the lawns and the guys that are working in restaurants who have a lot of Inca or Indian blood.
Yeah.
Referred to in Mexico, I believe, as Indios.
Indios.
I think. Yeah.
India.
Now, I have, common law is half Mexican, and if you were to meet her mother, you would think she's a little white lady. So that's the way it is. Yeah. So there are a lot of different, I would say, ethnicities among the Mexicans. So.
Reason being, there's a huge French, British, and Spanish influence in the mix, in the genetic pool. Why are we even talking about this? Oh yeah. Anyway, so it's not just the really thick, low hairline people that you may suspect. A lot of bald people in Mexico.
Lots of balding happening in Mexico. So yeah, I mean, I kind of was making a joke that they're not doing tests on Mexicans, but I meant the Mexicans that the stereotypical Mexicans that I'm pretty sure you were talking about.
Yeah.
Right. Yeah. Well, that's news to me. All right. What about the Germans? Are the Germans doing something? I thought the Germans were on something.
I'm trying to think off the top of my head. What's the latest on what's happening in Germany? Maybe someone in the chat room can tell me and kind of jar my memory, and I could probably speak
the
of
win, the WIN something one. There's the Roxatanaloo, whatever.
Yeah.
There's
I don't see anything that's brand new right now.
Right.
So
I've not heard of anything, and and just to address David in the chat room, there are a lot of bald Asians, not bald per se like Norwood Sevens, but a lot of Asians lose their hair. I don't think it's any lower percentage than any other ethnicity. What you do have with Asians is you have what I feel is a higher percentage of diffused thinning, particularly in the supposed safe donor zone as well. And I can say that because I live in a community that's about 80% Chinese. So there you go.
Apparently, it's a real bad thing to go bald as an Asian in China and Japan.
It's actually worse to lose your pubic hair in Asia. That's a whole other thing.
Yeah, that's a whole different
they get their pubic hair transplanted if they have thin pubic hair because it's a sign of sexuality and masculinity as well as femininity to have a bush.
Bush is healthiness.
Yeah.
Wow.
You don't watch Japanese porn, dude?
What are we talking about?
No, I don't watch porn, man.
That shit is wild.
Why would I want to watch something that makes me think women actually want to have sex? I mean, seriously.
Well, you also have to realize that he's in Utah. They don't have porn in Utah.
No, they do.
Yeah, I'm sure. I am. Yeah, I know.
They have 6 wives.
We're the big one of the biggest viewership is here.
Yeah.
In my little. You kidding me? I've got to hear people's crap all the time about that.
Dude, I'm sure. Pornhub is very popular in Utah.
Yeah, it is. It is. Well, it's good to hear from you guys.
All right, good to hear from you, man. Thanks for the call. Good luck.
Right.
Feel better.
Okay. See you guys.
All right.
Thanks. Bye.
He didn't hear from us. We heard from him.
I was like, wait, when do we start calling people?
888-659-3727 is a toll-free number. Let's see who this is. Hey, man, you're on the air. Who's this and where are you calling from?
Hey, guys. How's it going? It's Nico. What's going on?
Holy shit. Hey, Nico. Welcome.
Jesus, you again?
I love when you call in. We're just busting your balls. And, guys, we do have a line open if you want to call in right now to get through. It's 888-659-3727. And, again, we don't have a busy signal. What happens is you go into a weird type of prompting system. If you get that, that means that all the lines are busy. And keep trying. Go ahead, Nico. What's happening?
How's it going, Nico?
Hey, how's it going?
All right.
Sorry to bother so much.
Dude, honestly, you're really not bothering us. I just like to give you shit.
Jerking your chain.
Yeah.
Okay, good. So I'll give it back at some point. You know I will. Couple questions. And actually, I know I'll keep it brief. I actually am also, since I don't have his contact information, I'm hoping maybe next time, because Morty's going to call from Florida at some point. I was hoping he might be able to also share. I know Joe took a look at his license, but couldn't crop out the info. So I was just curious how those results looked, if he would grant you guys permission. But that's a separate thing. Just thought I'd throw that out there for him. So I guess shock loss question. Is it, I guess maybe thinking about just the donor area for now under a scar. I've mentioned this before. I'm wondering, is permanent shock loss the equivalent of slick bald, or can there be a point in which permanent shock loss might allow a stunted sort of stubble?
It can be a stunted stubble.
Okay.
Or not some, well, shock loss anywhere doesn't have to be bald. It can be just a greatly reduced density in an area that otherwise would have or used to have higher density. I've seen, in fact, I think that permanent shock loss issues, when I think about it, are usually not bald. They're just really thin, whereas temporary shock loss issues do tend to be more of a slick bald issue until it turns around. I mean, there's a lot of temporary shock loss issues where, and we're talking scar shock loss because of your case, where it is thinned out as well. But for there to be a slick bald area, if I recall, I've seen that more in a temporary shock loss issue than a permanent shock loss issue.
Okay. Cool. Yeah. Now I'm just trying to assess under my scar. So I've noticed it's sort of at a halted stubble. So I'm trying to figure out if that's permanent shock loss or some skin issues or whatever. So, and if I was waiting to see if Propecia might turn it around at all. So it just seems to be at a standstill at the moment, which kind of sucks. But yeah, trying to figure that one out.
One thing you can look at is if you can get a hold of one of those stubbles and tug on it to see how anchored it is, because it could be stuck in. Not that this would have a long-term effect, but it could be stuck in telogen where it's separated, where catagen has happened, but the follicle hasn't exited the tissue. So if you pull on it and it slides right out, then you know that it is in the telogen phase, and you can hopefully, fingers crossed, expect that new hair to come in to replace it.
Oh, okay.
Yeah.
Cool. Yeah.
I'm just keeping it on Joe because the studio looks so slick tonight.
Thank you.
Let me go back and look.
Yeah. I mean, you got the lighting down, man.
Yeah.
But it's just the right amount of light on your face with the right amount of light. There's not a lot of light on your padding, and it's good.
Why, thank you.
Very pimpy disco. I don't know. It's nice.
Yeah.
Well, that's going to be the upgrade. Is going to have a sparkly disco ball.
It's old school disco, man. It's like Studio 54.
Shit. So just another question, and I'll let you guys go, is since I'm trying to figure out, I know most people when they send in pics to you guys, and I sent pics across the last few months to Joe, just been a while since I did an update. Whenever I feel like I send a pic, or even when doctors present pics, they're always usually in their best situation. And I know, Spence, you say when you wake up, you got to paint a bit, and Joe, you mess around with getting the situation so it looks right. What's a good, honest way to send you guys pics to really highlight my problems that I'm concerned about? I mean, I know everyone's.
I would say, well, first of all, Joe's going to say a couple of things, I think, and I'm going to read his mind.
Styled is a way to take pics. Oh, sorry, go ahead.
But styled pics are good because at least it also gives you the opportunity. It gives us, or gives Joe the opportunity, or a clinic the opportunity to see the way your hair looks styled and the way that you want it to look styled. However, with that said, while you include styled pics, you have to include the real McCoy. Like if I were to show a clinic what's going on, this whole thing would be flying up to here. And the bald spot would be completely, there'd be no paint. And I will make, the worst possible way it can look, I will make sure they see that.
Yeah. Exactly. That's what I was wondering, because it's not just the average bedhead, and it's not even just styling it. It's like my hair got combined, sort of caught up between Propitia's trying to do its thing on the miniaturized hair, but with the design pattern, and I've had curly hair, and now I have some curly hair that's just all over the place. Just trying to get the most honest shots to you guys.
And I also think video is really important, because we're looking at in the chat room, we're talking about natural pics, outside light, natural light, all that stuff. Video tends to really, especially if you, even if you have a good phone, that takes high res video, in the right lighting, I mean, it really does highlight a lot of the important details that you cannot see in images. Now, Joe, you are a photographer. You wrote the book, essentially, on how to photograph and how to document your hair loss. I would say that, in my view, I think it's important for patients to send video. What do you think?
Yeah, I encourage that every time now. But I think one thing I always do when I'm asked this question is I revert back to the old school days of what doctors would ask for, or how they would evaluate hair loss. And what they would do is they would spray the hair with water and comb it back. Because when you're looking at, I mean, it depends on the kind of hair, but when you're looking at, or when someone's looking at a picture of someone's hair and it looks like you just got out of bed, I think those are the most. I just don't like those photos, and the reason being is because I can make my hair look like shit if I do the bedhead. I love my hair. I really enjoy, being able to style my hair and do what I want with it for the most part. But if I were to not style it and I were to actually get out of bed and it's kind of greasy and and then go out and get like a windstorm and just all the normal things that can happen before you start styling it, then it would completely misrepresent the reality. What I prefer to have people do is like I said, do a damp shot, not soaking wet, but just get like a spray bottle of water and just kind of a few shots and comb it back, and that way it keeps everything kind of, in a nice tight little package, and you can see where the thinning is in the general areas that thinning would normally occur. And compared to the areas around it, then an assessment can be made on just how much of a deficit we're looking at. But I also think that it's imperative for the patient to show the area that's bothering them. So I say this all the time is, in other words, don't style your hair as if you're about to go out on the town with the boys. Don't put hairspray in it. Don't put concealer in it. I've had people send me photos saying, "What can you do for me?" and it's got Topic all over it. It's like,
of course not.
What the hell are you thinking? So you got to show what the issue is, but don't do it like with your hair like all over the place, because that kind of defeats the purpose. I also don't agree with what my boy Bacatero Lion was saying about outdoor pics, because that can make even the best hair transplant result look like it needs more work, when in reality it doesn't. I think that's kind of misrepresentative of reality. It's a slippery slope. So like Spencer said, take video. That does add a dynamic that photos can't add. But then take photos inside with good natural light, and a lighting source has to be behind the camera, not behind you, or else everything's washed out. And then damp your hair, comb it. But then also include photos to show what the actual issue is.
But I also think, and I'm pretty firm on this, and you may disagree with it, but I'm not saying get out of bed head type of thing. But I definitely think combing through your hair and actually showing the exact areas where you need the most hair, and then showing a representation of how you walk around every day, gives the physician and the consultant an idea of really how to utilize your valuable donor the best. As opposed to just, okay, here's my bald spot, we're going to pack it in there. Show them that bald spot, that's great. You want to expose it completely so they know what they're working with. But you also want to show them how you look currently with the amount of hair you have in a natural setting, styled in a very natural way, without hairspray, without concealer, just like Joe said.
Yep.
But I definitely believe that if you have really strong deficits, show them completely so they know exactly what they're working with. But in order to make the smart decisions on how to really utilize that donor area, they have to see how you style your hair and how you look normally walking around, but without any type of product.
Right.
So that sounds convoluted, but that is...
No, not at all.
Yeah.
For me, and I'm sorry to take the time, just to comment on what you guys are talking about, is even when I usually do like that, I think a nice shot Joe was just saying about not an overly damp comb back. See, when that happens to me, since my hair is now partially just now a curly hairline and the rest of it's sort of miniaturized, trying to work itself out, maybe probably back into curly, hopefully, for consistency. I don't have that coherence, so I guess I have a hard time since my shit's all over the place, like the directions of the angles are all over the place. It's just hard to try to represent that, to show you how PC the shit looks like. With, like you said, there's the shot gloss around it, but it's just a fucking mess.
Well, that's the basic of what this comes down to is, no matter what kind of advice you get on how to take photos, ultimately the number one rule to remember is don't bother sending a photo if it doesn't show what the actual issue is. Styled, unstyled, wet, dry, doesn't matter. If you can't see the issue, then you're wasting everyone's time. I mean, it's nice to send photos to show how you're actually styling it. If you're actually able to hide the issue, sure, send a couple photos like that too. But you got to look at the photo yourself and evaluate, can I see the issue that I want them to see in this photo, or do I need to take another photo? Because if the answer is no, I can't see the issue that I'm trying to get them to see.
What's the point?
Then just don't bother. Try again.
All
right, man. Listen, I hope we're able to help you tonight. And we're gonna be here Friday.
Cool.
All right.
Yeah.
All right. Listen, Nico.
All right, guys. Be continued. I'll talk to you guys soon.
Love you, man. Thanks for the call. Have a great night, and call Friday.
Cool, man.
All right, man.
Take care, guys.
Take care. Bye-bye.
Thank you.
888. I didn't mean to cut you off. 888-659-3727. Guys, every time we drop a call, we have a line open. So call in now to fill that line. That's 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this, and where are you calling from?
Well, Spencer, this is Dave from Brooklyn. How are you?
Dave from Brooklyn. How are you? What's going on, man?
Hey, what's up, Joe? How's everything?
Yeah, there you go. I'm good, man. How are you?
Great. Thanks a lot, gentlemen. I have a quick question. Yeah, I've got a quick question for you. I was having a conversation with somebody, and we were talking about, finasteride, and I can't think of anybody more qualified than maybe doctors to ask this question. And I just wanted to know if, let's say, for example, there's 100 men who are genetically destined to become Norwich Sevens, right? And I know there may not be a perfect answer to this question, but
42.
So hypothetically, okay.
Continue.
So less than half, right?
No, it's the answer to everything.
Yeah.
42.
Okay.
It's a literary reference. Sorry. Go ahead.
Okay. Sorry. So if these 100 men were to begin finasteride before they lost a single strand of hair, by the age of 50, if you were to guess, how many of them would have their hair, and to what extent would they have their hair?
That's an excellent question. And all we have to go on is the 5-year clinical data, which shows in the first 2 years, 87% of the men who were in the clinical trial, who were using the drug, saw a cessation of hair loss or hair regrowth. That tapered off over time, but the 5-year data still showed that men who started the drug after 5 years still maintained more hair than those who did not. So to answer your question, how are we gonna know if someone, you know, who has never lost a hair will be able to maintain their hair using finasteride? Well, it appears that at least that percentage of men were able to maintain their hair and regrow some hair for a pretty significant period of time. So based on, if you extrapolate from the clinical trials, based on those clinical trials, if someone starts before they're losing their hair, and you didn't give an age of starting, so is it, do they not lose their hair and didn't start till 45? Then we know that there's probably about an 87% chance that by the time they're 50, they're going to be maintaining their hair. But if they start at 20, we don't have that data. We don't have the 30-year data. Was that convoluted and confusing, Joe? Was that convoluted enough, or you got it?
It just kind of hurts my brain to even think about the answer to that question because there's so many possibilities.
Sure.
I'll defer to Spencer.
Yeah. I would say that is the only possible answer I can give. That currently, with the data that we have, all you can do is guess if a guy is 45 years old, given your question, and has never lost a hair in his life, but is genetically predisposed to losing their hair, that there's that much of a chance. Now, that's also given that every user starts to lose their hair at the same time. As soon as right after they start taking that drug. So that's a very difficult question to answer accurately. It is beyond hypothetical, and I don't even know why you thought of it.
I can tell you, I can add to that and say that if there are 100 guys that have complete full heads of hair, and you ask them, would you like to take a pill to most likely prevent any hair loss in your future, most of them will say yes.
Yes.
How's
because
that?
in essence, finasteride, it actually is the closest thing we have to a cure. It acts like a vaccine as a preventative, right? The same way we don't have a cure for polio, but we have a vaccine to prevent it.
Well, it's more. I would say I would liken it more to like using insulin to control what would be a lot of people consider to be a controllable, manageable disease.
Yeah. Well, I used to say it's a treatment, not a cure.
Yeah, as opposed to a vaccine.
Just like brushing your teeth is a treatment against tooth decay, not a cure. There is no cure for tooth decay.
Right. So, you're not necessarily vaccinated, because we do know that even those who are taking Propecia, including myself, or who's on Proscar, will see a progression, be it slow, at least in my case, of hair loss. So it's not like, if you're given a vaccine for polio, you're not going to get a little polio. You know what I mean?
Yeah.
Right.
So, and I'll just say Spencer just messed up about 700 to 800 people over the course of this video for the next few weeks when they're like, wait, he said he's taking Propecia, but why is he taking Proscar?
Right.
Wait. What does that mean?
Yeah.
I start looking it up. I start getting emails. What's the difference between... Anyway, sorry.
We'll get some good questions, so
Thanks a lot.
All right, man.
Thank you so much.
All right, good luck. Thanks.
Thanks for calling.
Bye, guys.
888-659-3727.
That just screws people up, man.
This hair loss thing is just wild, man. It's wild business. Wild, just the thought process and I get it. I get his question completely.
Oh, yeah.
But who can answer that?
All right, FSK. What's the difference between Proscar and Propexia? I know you might say Propecia, but yeah.
Hey, man, you're on the air. Who's this and where are you calling? Again, where are you calling from? And again, if every time we drop a line, that means try to get through, because that means there's a line open. How are you, man? Who's this?
Hey, Spencer. Hey, Joe. This is George.
George, what's happening, man?
George, what's up, buddy?
About to get hit with a tropical storm here, which is up on the edge of turning into a hurricane.
Tropical Tuesdays.
So what does that have to do?
Yeah.
What does that have to do with hair?
Well, you just asked me what was going on. I'm just, if you want to be a smart ass, you asked me what was going on, and I'm just telling you, man. So I want to forewarn you, the wind is whipping up outside at any moment. The cell phone tower could go down. and the internet's kind of going in and out. So you guys keep freezing up. By the way, Spence, you nailed it. Joe just looks like a freaking Hollywood star tonight.
There you go.
His lighting looks almost surreal, like it's like something being shot in a Coppola film or something. It's crazy.
Yeah.
Thank you.
He finally got it. It only took 5 fucking years.
Well, I had it before, and I forgot what I did, and I was actually thinking about this yesterday or this morning. I'm like, it's just too damn bright in here, because I thought it was a setting on my camera. So my studio actually has a floor-to-ceiling window on one side of it with blinds, and that used to be enough with camera settings I had, but I forgot the camera settings. So I got one of my back screens for my studio shoots, which I never use, and I just strung it across the entire length of the window to reduce the light. So
I have I had to have a whole thing made, which cost like $5,000, by the way. Floor to ceiling, all the way across. It's it's soundproof black velvet curtain, a singular curtain that's on a rod. It goes all the way across.
And yes, it has a bull on it.
And there's no bull.
And a matador.
That goes all the way across to block out the incredible light that would be in this room, and also the sound that would be coming from outside now that we're doing the show from Beverly Hills.
So thank you.
But yeah, it's great. I told you, man.
Your microphone and telephone and sound system is so incredible. I'm on a Verizon wireless iPhone 6, and I got an LG Tone Bluetooth headset on. And my God, you dudes sound like you're talking right into my ear, and you sound like you're sitting right next to me on my couch. It's incredible.
Well, listen, we do our best to work our magic, or I should say, I do my best to work my magic, and Joe has done his best now, and he's fucking got it to work his magic. But yeah, I mean, this is
it's just so ultra professional looking, man. The big sound, the video, the whole deal, and I always forget how much I miss your show when I'm gone for a while, and I come back and I'm just laughing so hard, and it's so funny and so interesting. I can't believe I'm finding this stuff still so entertaining and interesting and fascinating, which is a tribute to how good you guys are.
I appreciate it, but I can't believe it.
After 20 years of this shit, you know, I'm like, after 20 years of it, I'm thinking, why am I still so entertained and, you know, by this? But
you know what? Tell some of the genius doctors out there that, you know, these guys who are, I'm telling you, they're destroying their own field. Because they won't listen.
I told you I was pre-med at one point.
Yeah.
You know, when I started college, and when I found out that the whole thing was a fraud and it wasn't about health and wellness, it was about, you know, medicine, drugs, and surgery and copays, and when I found out, you know, about natural medicine, about how the industrialists, Rockefeller and Carnegie, ran all the natural medicine people out of business and started pharmaceuticals with petroleum-based drugs, and then over the decades, you know, it all got taken over by Big Pharma. Then after World War II, the Nazis, under Operation Paperclip, that ran pharmaceutical companies over there that experimented on the Jews, they actually came over here to run our pharmaceutical company. So I kind of like lost faith in the whole thing. And
well, let's put it that way. That was a fascinating story, by the way. But let's put it this way. I got comments from an editor, and this guy he's a smart guy. He's a doctor that was actually educated here in the United States, who essentially told me that I would need to dumb down my article because it was his belief that the membership wouldn't understand terms like, I'm going to read a few of them. Commoditized, opportunity cost, or conformance obsessed. Just those three terms.
The arrogance of these people blows my mind. Well,
that's actually that's not arrogant. That's just shit. That tells me, like, you actually believe that the article has to be dumbed down, because even though, there's a large portion of the people who are part of this organization who are not English speaking, there's something called Google.
It has to be dumbed down for people that have had some of arguably the most lengthy schooling on the planet.
And you know, for someone to be bored with an article that I'm gonna give you guys a title. Well, basically, part of the title is "Your future depends on this." I'm not going to give you the whole title, and it starts off with something incredibly compelling, basically saying the clock is ticking. You guys got like 36 months to get your shit together. Otherwise, it is all over. Do you believe people are going to get lost because they don't know what the word commoditized means? It's just unbelievable to me. It's unbelievable to me. You know, I feel so sorry for these doctors who really care about patients, who are being basically led to the slaughter. These guys, they're going to have to close their doors because of the competition that's coming around the corner. It's going to be a fucking tsunami. Right now, this is the calm before the storm, and they are losing so many patients to really bad people. This is just the beginning. The tsunami is about to hit, and these guys are, you know, they're fucking playing whack-a-mole. And it's so sad to me that patients like yourself or whoever is considering surgery, they're not going to have these great choices anymore. Anyway, go ahead.
I was going to ask you and Joe, I have been in and out of the program over the last few weeks because of a lot of personal stuff going on. And when I've been fading in and out, I've noticed that something monumental and somewhat calamitous has occurred, and I am behind the curve, and I don't expect you to catch me up now. I guess I just need you to point me in direction. The internet's frozen again. My internet keeps freezing because of the storm.
It's okay, just listen.
But I need you guys to point me in the direction for later on to get caught up with what the hell is going on, because I realize something major has happened, and you know, because I can hear you talking about this, that, and the other, but I really don't know what the hell happened.
In short, you know, years ago, we discussed the possible, or what I predicted to be catastrophic events that were going to essentially destroy any chance for this field to have any true standard of care, where there is a across-the-board standard of care for hair transplant surgery. And that is when device makers basically started to come in and start to sell and promote their devices to non-core physicians, and really working off the old model that the hair transplant industry set back in the 70s and the 80s and 90s, that hair transplant surgery was a simple procedure, simple outpatient procedure, as easy as going to the dentist. And that led the way to these device manufacturers coming in after FUE was introduced to essentially say, well, wait a second. They've already set the tone for us. We just have to go to, you know, sell these devices to these cosmetic surgeons and plastic surgeons and guys who are used to purchasing a device for $50,000, $60,000, $100,000 like a laser, and saying, hey, look, you can make $10,000 a pop doing a hair transplant with one of these. All you have to do is you know, bring in some techs, put the shit in the corner, and sell surgery. And away we go. So in 2010, actually, Alan Bauman and I did a interview about this. I interviewed about the dangers of what's happening, and no one fucking listened. And then finally, the ISHS came out, and they tried to do something about it way after the horse is out of the barn. And so essentially, the new normal of the hair transplant industry are not hair transplant doctors. They are dermatologists. They are cosmetic surgeons who may be, you know, any form of a doctor. They are board-certified plastic surgeons and facial plastic and reconstructive surgeons who are buying turnkey devices, putting up a shingle, and letting other people do the work. That is what the industry is. And essentially now you're dealing with, because it's so commoditized, just tire kickers, where before, 10 years ago, people would realize, okay, hair transplants are expensive if you want to get a good one. Now people are like actually contacting doctors through sites like, I'm not even going to say, you know, these cosmetic surgery sites, and they're saying, I have $3,000 to spend. Can you do it or not? Because I know the guy down the block will do it for $3,000. And that's really what the industry has turned into. So many people are being harmed now because it's being sold to the point where it's just, not only is it just a commodity, but it's a cheap commodity, something that takes, like, getting your nails painted or getting to get a facial. The surgery and the medicine has been completely taken out of it. And the doctors, in my view, those who are responsible for this are the arbiters of the great arbiters of the main hair transplant organization, the guys that make all the decisions. They just basically opened their doors and said, fuck it, take everything and destroy patients in the process. So I know it's a long diatribe, but it's pretty sad.
Let me ask you a quick question about this.
I don't mean to cut you off, but do you think this would happen in dentistry?
Hell no.
It couldn't happen in dentistry.
Well, hang on. We do have something. We do have something called 1-800-DENTIST.
We have 1-800-DENTIST, but at least they're all fucking dentists.
Well, exactly.
So we think.
The hair loss, the hair loss sufferers. Our community and our plight has never been taken seriously enough, and it's a friggin' tragedy and disaster. And you guys, this makes what you.
Oh man, your internet just went out, and we lost your call.
You just got hit by Cat 4.
Oh, I hope it's not. I hope it's not my internet. Let's see.
No, I can still hear you.
Yeah, but I'm just going to make sure it's not my Vonage line. You there, dude? Let me see if there's a line open. Okay. Call back, man. 888-659-3727 is the toll-free number. We'll take another call in a second, but George, I'll give you a second to call in. 888-659-3727. Yeah, I mean, I know I'm very passionate about this, and I wanted to really educate this organization to let them know, I wanted to make it heavy on the problems and then create the conversation to talk about the solution, as opposed to giving them some sort of a blueprint of the solution that they wouldn't. It's like giving someone a key to a lock and they don't know how to fucking turn the key. They can't open the door.
They're giving them plans for a rocket engine.
Yeah, it would make absolutely zero sense for them. And I hate to use the word, because it's insulting. It is insulting. But I hate to use the word stupidity. But the stupidity of it all. I'm not just talking about, this particular person is a smart guy. He's actually just, I think, trying to play interference, as he said, for the people that make the real decisions. But the stupidity of the entire field and the bureaucratic identity that they hold so dear is destroying themselves. Like I always say, you don't need to murder someone who's already committing suicide. You don't have to go through that process. You don't need to make that effort. It's going to happen on its own. I'm trying to provide these guys advice on how not to commit suicide, because if they commit suicide, they are putting so many people in jeopardy, at least for a few years.
I agree.
And
I agree.
They just don't get it.
No.
It's like, hello, yes, you are making $500,000 a year less this year. It's real. What's happening is real. So look at it from a business perspective. Forget about saving people's lives. You're a doctor. Forget about your Hippocratic oath.
I said a lot of them have.
Yeah, first do no harm. Forget about all that stuff. Let's just think about dollars and cents. You know what they think about?
Do you want to make your Ferrari payment?
Yeah. You know what they think about? Oh, wait a second. Where are we wasting the money now? We're not making as much money, so let's make cuts. Let's do this. Let's do that.
Yeah.
Guys, wake the fuck up. There's only so many cuts you're going to make before you have to start cutting into your salary. And then you're going to have to start cutting your staff. And then you're going to have to make your offices smaller, like a couple of guys here in Los Angeles who are competing against 80 machines in a 3-mile radius.
That's ridiculous.
You guys are fucking finished. You're like dead man walking, and you can't even see it. And I got to laugh. I have to laugh when I'm like, why am I even putting this effort forth? Why don't I just take the young guys who are willing to learn, which is what I'm planning on doing, and recreating everything, and that's it, and then let these guys fly, flap in the wind.
I think you just touched on a great way to put this into perspective for people listening, but also for doctors listening as well. Not that they're not people, but you know what I mean.
Doctors are people too, man.
People and doctors.
Yeah.
Is exactly what you just said. It's like two doctors have had to reduce the size of their clinics because now they're competing against 80 machines in a 3-mile radius.
Right.
So if you actually visualize that when you're online and you're looking up a business, 10 years ago, you could have, like in Los Angeles or Beverly Hills, type in hair transplants, and you would have a small handful, just 3 or 4 clinics in a larger area than 3 square miles performing hair transplant surgery, and they were proper doctors where they had proper staff, proper training, proper experience, for better or for worse, doing hair transplant surgery for whoever came in the door, obviously. So, but now you do that. So your 4 little dots on your Google map is now this dense 80 dot per square centimeter is this dense representation with 80 dots instead of like 3 or 4.
And I got to say, this sounds.
And I visualized that and it just blew my mind.
This sounds insulting, but some of these idiots are choosing to compete with these little dots on the same playing field, diminishing who they are and their experience and their qualifications, not really trying to differentiate themselves except by the specials they're fucking offering to people online. I have never seen such idiocy. I have been, and I wrote this in the article, I've been an entrepreneur since the age of 19. My first paycheck that I drew when I was in my dorm at Penn State was 3 times what my father was making. I'm sorry. It was what he was making in about a 3-month period of time. I have gone my entire life from business to business to business and really solidly focused on this when I was in my late 20s and early 30s. With not saying that people don't fail, but I've been lucky enough to succeed in just about everything that I've done. Some small little trip-ups, but lucky enough, and that's rare as an entrepreneur. I'm just saying that. Most people fail a lot before they succeed. I did fail a lot with trying to get the book published. I was turned down by 14 agents and 33 publishers, but I just kept going until finally someone said, okay, we'll publish the damn thing. But I think about these guys' decision-making skills and their total lack of qualifications for the guys that are leading their charge. And I can't even believe it. I can't fucking believe it. And you know what? Forget about, they're making their families and their lives, they're suffering, they're having sleepless nights. That sucks for them. But in what's really happening is that patients don't know how to make the right decision anymore. The Be Loud and Stand Proud campaign, it's not going to work. That may have worked for a different demographic of trying to get demographic of people.
I keep thinking of Harvey Milk when I hear that.
Yeah, that's exactly. That type of language works for marginalized rights.
Yeah, get out the vote type of stuff.
Yeah, but not for fucking doctors. No one gives a shit. Let's take a phone call. Hey, you're on the air. Who's this and where are you calling from?
Mo from New Jersey. How you guys doing?
Hey, Mo. How you been, man?
Mo.
Doing good, man. I mean, I will call in for a few weeks, and then Joe's already causing a stir on the internet. What the fuck's going on?
That's what I do, man.
Every time I call, there's always something going on with you, Joe. You got to stop pissing people off.
You know,
I can't help it.
This is a sad, perverse part of life. When you do something good in life, you end up annoying a lot of people.
Yeah.
Listen, man, I've been listening to the entire show, and I've really just been, I mean, it's funny. It's sometimes, I mean, in a way, Joe's kind of also made, I mean, you too, Spencer, but like Joe's made, like, since he, since he's on YouTube and he has his own channel and things like that, he's kind of made hair transplant like a hot social, like, like Eminem, everyone's talking about Eminem's this and this and that and a machine gun kill, like hip-hop. He's made it cool, you know what I mean? Like, Joe's kind of done something revolutionary where, I mean, you guys both really have done something revolutionary where, hair transplant has become like, like an internet kind of sensation in a way. You know what I mean?
Well, I would say, and I get what you're saying, and I think that Joe gets a tremendous amount of credit, and he should, but I think that making it, I think Joe does a lot more than that. I don't think it's just about.
Listen, I'm just going to say I think.
Yeah.
No. When I say that, in no way do I mean that. I mean, when I called on the show, I mean this 100% sincerely. I think Joe's the one. I mean, I've researched my ass off, but if there's someone who really opened my eyes to not just how to go about it the right way, but how fucked up the industry is, it was Joe. Like, it really, then that's what led me to the show.
Joe introduced he introduced you to what we do, and if it wasn't for Joe doing what he does, and if it wasn't for, this is an interesting point. When Joe became an independent, everybody fucking freaked out. No one wanted to work with him. People were fucking scared shitless. They didn't want to make him to make money off their forums. They knew his voice was too big. I'm like, I want this motherfucker as my co-host. I want this guy on my forum. You know why?
Right.
He adds value. Not just because he's a normal guy and a nice guy to work with, but he adds value to what I do and to what you guys need. Go ahead.
And what's even and thank you both for your comments. But what's even funnier about this whole forum thing is I'm not really on the forums.
Right.
I don't. It's like someone actually brought this up the other day, saying I apparently am upset because I'm not on some forum any longer. And it's like I'm glad I'm. It's like it's not even on my radar.
There's a well-known doctor who at one point was like terrified to be removed, or he was being defamed and terrorized on one particular forum. And I mean, I remember the stuff that he was writing. It was fucking pathetic. And then finally, he's asking me, what he should do. And I'm like, what do you mean, what should you do? Just fucking go, man. And he's like, years later he came to me and goes, that was the best advice you ever gave me. I have not had peace of mind in my work life like I do now for years of being involved with these people. And now I do.
But you know what it is? I feel, listen, in a way, this industry, I mean, there are a lot of industries like this. You see the best of the best, but the worst of the worst also. Like, there's no doubt that, the results you're getting now, and also in the past few years, is some of the best results we've ever seen. Obviously, because it's a very young industry, right? But it's also some of the shit that goes on. And when you have somebody that goes out and exposes it to that degree, listen, I mean, it's funny when I don't even think Joe responded yet when I saw that comment. And the first thing, any logical person in my mind, the stupidest thing about that was, I don't know, Joe, do you know this? He made a whole Facebook page to expose you. Have you seen that?
Yes.
Yeah. So in that Facebook page, he writes, "Oh, this is a guy who's had failed transplants." Well, no fucking shit. If you watched any of his videos, he's talking about how he's had failed transplants and how he kind of went from that to going back to looking like this. So
look, some people like to make fake Facebook pages when they learn that 2 + 2 = 4.
Right.
I mean, it's
like I said before. I mean, when someone is in the midst of committing suicide, you don't need to murder them.
I mean,
the rope is getting longer and longer for enough slack for this person to essentially and eventually hang themselves. That's just the way that it is. Look, I've dealt with online defamation my entire career, and this stuff has been put up, really nasty stuff that I had to go out there just in case something like this would happen again and prove that it was all false and defamatory. I have a stack this high of affidavits and a lawsuit about this thick, which I sent this guy into something called a 998 offer to compromise. Ended up, we tracked out the person who was doing it, something very similar that's happening now, and ended up being a hair transplant surgeon. And
let's be. We're grown men here. We don't know.
Let's put it this way:
it's a group of surgeons who are doing this.
Well, yeah, and let's put it this way: currently, this person is now living in his parents' home in his hometown, and he is no longer practicing hair transplant surgery. And this isn't to sound threatening to anybody. This is to say that, like I said, you don't have to murder somebody who's already in the middle of committing suicide. Eventually, if you can't talk them off the ledge, they're going to jump.
Right. Yeah.
That's just the way that it is. Yeah. So, my advice to anybody who's doing this is just like, people have to have empathy in life. They have to realize that, unless you're putting out the truth, I mean, going out there and trying to harm people's reputations, it doesn't solve your problem. It's like you're essentially trying to put out fires, right? And by defaming other people potentially. And those fires that you're trying to put out or you're trying to deflect are now igniting much less controllable fires. And your ability to sleep is just getting smaller and smaller, and your ability to you're having to deal with shit is just going to get greater and greater. How is that effective in life? How does that help anybody?
I don't get it.
It doesn't help anybody.
It doesn't. But listen, I just don't. Just on the basis of logic, right? I mean, for the past, let's say last month, right? I mean, what has a lot of the show been about? We've been criticizing an IHRS member, a member that obviously, Spencer, you founded, right. A member in your organization, and we've been putting him, I don't want to say down, but we've been critiquing him more than non-members. And I don't understand we've been, this community right here, I mean, Ball Truth, Joe Tillman, hair transplant mentor, it's the most, it's the most honest one, and that's what stands out. And I just don't understand, we all know it's a clinic or a group of clinics behind it. And, what's funny is it's still also this, and, it's not just the clinics anymore. It's sometimes people take things very personal, like, for example, Turkey, right? People always say, I mean, that's one of the things that I think someone wrote, some idiot, I don't know if it was him, but people keep saying you talk bad about Turkey, yet they go there more every year. Well, does that mean that they all have great results? And listen, it's not. People take it so personally. It's not anything against the Turkish people. It's not anything against the culture of the Turks.
Here's the thing. I've not been accused of that. I've not been accused of being anti-Turkish or whatever, as far as like the people or the culture or anything like that. And that's good because I think Turkey is a great country. I was there twice in 2015. Blew my mind. The food, holy shit! It's like my favorite food besides
the women, Joe.
Besides Italian.
The women there?
The women, the culture, the history. The history is incredible. It's like the Ottoman Empire. The history behind the Ottoman Empire it's mind blowing. But I am against hair transplants in Turkey in general, simply because if you don't have a solid track record in front of you for that clinic, you know nothing about what you're getting into. And
of course,
I've been into one of these clinics. I mean, it was one of the better. When I say better, I mean it was probably one of the cleaner mill type of Turkish clinics, but it was still mind-boggling how much of a mill it was, and the tactics they were using to try to get me to shit. I almost had surgery. They were so good at.
Was this the one you made the video for?
Yeah. I opened the phone book and or online, and it was almost like just doing the close your eyes and just throw your finger down somewhere in the phone book and go there. That's essentially what I did, but with Google. And I called up, and next thing I know, they sent a driver across the Bosphorus, which is there's European and Asian side of Istanbul that's separated by the Bosphorus Sea, and it's like this narrow channel, right? So they sent their clinic was on the European side. I was staying on the Asian side. It was like an hour trip one way. So they sent a driver to do a two-hour round trip pickup just for a consultation, because they knew that they had a strong chance of turning me into a surgery the next day. It was like 2:30 in the afternoon when I got there. If it was maybe an hour earlier, they probably would have tried to get me to do surgery that day. And they had their shit down pat. Like, I came in for a consultation, and within 5 minutes, I'm in one room, and they're drawing my blood. It was.
I mean, I saw the video, and it was ridiculous. It's just, it's mind-boggling. But people, and I think, and another thing is, you guys have been probably one of the only people that have been critical of the UK in general. Of kind of saying, obviously a country with developed and respected physicians, just generally, not hair transplant physicians, but respected physicians, have a really bad track record of hair.
I would say, in general, the entire cosmetic surgery field in the UK is an abomination, in general.
Yeah.
And
I
there's so much bullshit that's going on. Hair is horrendous in the UK in general. Now, there are a few clinics who are now being hassled because they happen to have the most consistent track records, and guys who are either part of what we do or who are connected to the BAHRS, which has nothing to do with the IHRS, or who are just in somebody's way. The reality is, it's sad that this occurs. Why not just say, hey, you know what? We're going to listen to these guys. We're getting a lot of crap, or whoever's out there doing doing this stuff. If it is a group or a clinic, we're getting a lot of crap. Let's fix things. Let's hire the right staff and find the right doctor, and maybe, I don't know, change our name. And I have to tell you this: if a guy can go on YouTube and declare himself the fucking son of God and come back from that, there is nothing that can't be accomplished in this industry.
You can do anything.
Yes.
You put your mind to it.
Because it's such a low regulated industry, you really can't do anything. But this last point, and then I want to listen to the rest of the show.
Yeah.
Is that you asked why not just do it, because you know why? The route you guys are taking, and not just you guys, obviously, the ethical clinics out there, a lot of them which are, members of your organization. It's not a quick buck. Yes, there's a lot of, I'm a proud capitalist, right? So there's a lot of money to be made in an ethical way. And in the long term, possibly even more so. But it's still not a quick buck. And human history has always shown, not human, I'll say majority of people, in the world always are attracted to, get rich quick schemes, lose weight fast schemes. I mean, this whole, you're going to get your entire hair back in one, and for $3,000. This whole people are attracted to a quick buck, and the thing is, you guys, it's just not attractive. You guys don't provide that for these clinics, obviously. And I mean,
but here's the thing, and we don't. But here's the thing: I have always played the long game. I would not have survived more than 20 years in this field doing what I do, and essentially being in the crosshairs my entire career. before Joe Tillman was ever put in the crosshairs. And forever. I mean, I'm talking about from the day I got on the radio. We're talking about the large chain clinics attempting to quell me. Guys who, there is a story that there was the owner at the time of Medical Hair Restoration who actually told the current editor of the ISHRS, they were at a meeting, turned around and said, "Your boy Kobren is finished." This was 1999.
Okay.
Then I get a call from our two biggest sponsors. Actually, first I got a call from the radio from the radio station, but then I got a call from the two bigger sponsors, both pharmaceutical companies, saying, "You know what? There's too much controversy wrapped around your program. We kind of want to step back from it." So they actually had Merck Pharmaceuticals, and at the time it was Pharmacy Upjohn, pull out of the Ball of Truth, and they were paying a tremendous amount of money to make the show national. And I realized most people would have been like, "Oh shit, I'm going to close my doors." You know what I did? I got on the fucking phone and I sold every local market myself because the radio guys couldn't do it. I did that in a matter of a week. And those sponsors stayed with me for more than a decade. And that move to destroy me made me more money than these guys. And this guy sold his practice for like $25 million. These guys made me more money than they could ever have imagined to make in a lifetime. Just because, and I always say this, and I repeat myself, and I'm king of the one-liners. I'm like Henny Youngman, but it's not funny stuff. The fastest way to lose control is to try to control everything.
Yeah.
And that's what's happening with online defamation stuff. That's what happened to this doctor who attempted to defame me. He lost everything. Everything. And so you can't go for the quick buck. Sometimes you have to embrace and evolve with the change and say, you know what? Shit's being pointed out. Let's fix it. Let's work with these guys. Let's figure it out.
But again, it's just not. You're right. It's just people aren't like that by nature. But fellas, I want to listen to the rest of the show. I don't want to keep talking.
I was going to say, let's get back to saying how I made hair transplants cool.
Yeah.
I mean, hey, it's
I'm kidding. From
Paul McCartney
I appreciate it.
To all this. I mean, hey, man, you guys have made a hit. It's going to be a part of hip hop. Next thing you know, we're going to be hearing his song in the Drake song. Joe in a Drake song. Or something.
Well, let me ask you, all you guys, this. All you guys who want to see that happen, just fucking get out there, like this program, share everything. Subscribe to everything we got. Subscribe to our iTunes channel, even though we haven't put up anything new in a while. I mean, we're slowly drip feeding some new stuff, some older stuff on iTunes. Make sure that you subscribe to Joe's page. Subscribe to thebaldtruth.com. Get the word out there, the real word, not the bullshit, not the guys who are out there trying to destroy good people's reputations out of fear.
You know what? I'll definitely be doing that. Well, fellas, keep your heads up. If you're doing something right. If you're pissing off people, I want to listen to the rest of the show. I'll talk to you guys.
All right, man. Thanks for the call. Thanks for everything. All right. Joe Tillman, making hair transplants cool.
That's my new motto.
Yeah.
.com.
That's
fun.
I had a funny one. I just lost it. Hey, man, you're on the air. Who's this, and where are you calling from?
Hey, man, it's George. I didn't hang up on you. The phone disconnected.
Oh, hey, George.
What's up, George?
The eye of the storm is nigh upon us, so we're having experienced intermittent outages of everything. Quickly, let me get my question in before this thing drops again. I can't see you guys. I don't have the web up right now, but I had told you, Spencer, that I had watched a series. There's a guy out there that does documentary films named Jeff Hayes. He does really excellent documentary film series. He did one called The Healing Miracle about stem cell, and he had like a bunch of different docs and people on there. He even had Mel Gibson on there talking about how he saved his father's life. He was in his 90s and was almost dead, and he took him to
I saw that.
buddy of his. it was friggin' amazing.
Yeah.
I mean, like guys on the edge of death, and the next thing you know, he's like pushing the wheelchair around, chasing the nurses and having fun, pushing the nurses around in his wheelchair. Well, there was a woman doc on later in that series who was some kind of cosmetic or plastic surgeon, and she was talking about how she was doing stem cell injections and helping people regain a lot of hair. Now, this guy, Jeff Hayes, clearly said at the beginning of the series, he did a disclaimer and said, I didn't personally vet every one of these people, everything they're saying to the nth degree. I did not do that. This is for information purposes, blah, blah, blah. But, there was obviously some really legitimate science in this series. Do you know if any doctors are doing that and having legitimate results? And if so, can you have them on to talk about it?
Well, the reality is a lot of these doctors who are claiming that they're injecting stem cells and utilizing stem cells for the treatment of hair loss are simply doing platelet-rich plasma.
PRP.
Yeah.
Yeah.
And, so there's a lot of confusion out there. And I think there's a lot of forced confusion because the whole stem cell mantra and the marketing aspect of stem cells, it's very sexy to say that you're re-injecting stem cells into somebody's scalp. Also, when you are working with like, a cell or porcine, these porcine, what are they called, Joe? Matrixes.
Matrix, yeah.
And also some of the stuff that's, derived from your own body. Yeah, there are stem cells involved. And now there are some guys who are actually utilizing stem cell treatment intravenously, and they are getting umbilical cord stem cells, which in reality, there's a very small handful of guys doing that for hair loss. Those are the only guys that are actually, in my view, utilizing and marketing stem cells correctly, in a more honest way. They're getting stem cells from another source and then putting it into another person's body intravenously while providing PRP therapy. So most of the people out there that are claiming they're doing stem cell therapy for the treatment of hair loss, using injections, putting your blood into a centrifuge, separating the blood from the plasma from the blood, and then increasing the growth factor. You're laughing about something, Joe.
Yeah, something in the chat room.
All right. Are not offering what they're claiming to offer. What's so funny? I want to hear it.
I'm not going to talk about it. It's just someone's. I can't.
Say it.
Someone's doing videos about online dating now.
Oh, okay.
Oh shit.
All right.
Anyway.
So
So what you're saying is at this point, they're not really, in your view, they're not legitimately doing the procedure that they're promoting. They're actually doing something different. Therefore, thus you don't consider it worth wasting the program.
You are re-injecting stem cells into the body when you're doing PRP, right, into the scalp. So I mean that's the way that it is. It is a cell-based treatment using your own cells. However, they are promoting it in a way that is, I think, disingenuous and makes it seem like it's something that it's not.
I got you. Well, some of these, apparently the stem cell guys now are talking more about like taking some of your own stem cells and banking them, for use as you get older, so the stem cells will be younger, and actually reproducing them, in the lab, growing them.
There's a couple of companies. One company I was watching for a long time, I think it was something with an O, and then they changed companies. They would essentially take fibroblasts or stem cells, a punch of skin from the least damaged part of your body, which is usually right behind your ear, and they would reproduce those fibroblasts, those cells that create collagen, right? And they would then multiply them millions of times, store them for you, and then re-inject that into your face to create collagen and to essentially reverse time. So that was the thing. I've been watching this since 2001. Now, I know I look young, but I haven't gotten that shit done. But
so imagine when he does use that stuff.
Dude, forget about it.
He'll look 5.
Yeah, forget about it. So, yeah. So, listen, I know you're all into anti-aging and you've been following this shit for a long time. I've been following it for a long time as well. I could say that so far, we just ain't there yet, man. Sorry to bust your bubble, man.
Well, it's, I understand. It's just, like you, I can't get super excited about getting cut, but the ProScar is, losing its effectiveness for me, and I've had a lot of progression of thinning, and there's some things I'm going to do on that, but I'm just trying. It just seems like with all this other amazing medical stuff going on, it seems like we're due for a big breakthrough.
I'm looking up articles. Injection of genetically engineered fibroblasts corrects a regenerative skin in mice, 2003. Autologous fibroblast culture in the repair of aging skin, 2012. Okay, this is a recent article, relatively recent article. And human cell cultures are being developed to replace various body tissues. Objective, to assess the safety and efficacy of dermal regeneration with the injection of young autologous, I was mispronouncing that word, fibroblasts obtained from cultures containing serum from platelets themselves. Result. On the fourth population used, doubling a mean of 3.85 blah, blah, blah cells, blah, blah, blah. 60 days after completing the treatment with 4 injections given 15-day intervals, periorbital tonicity had improved significantly. So basically these guys injected genetically altered or genetically derived fibroblasts into people's orbital region, eye region, to see if, in fact, it would reduce the signs of aging. And it did. Great. They cultivated something called M1999. This is in 2012. There has still been nothing to come to market. That's 6 years ago. That sounds pretty exciting, right? That's some anti-aging shit. That's something
that they're working on the friggin' rocket to take us to Mars, and they still haven't solved this air shit. It's just really pissing me off.
That's some anti-aging shit right there. But who's seeing it? God, maybe you got a lot of young scientists young-looking scientists walking around.
I will say,
and a lot of young-looking mice.
Another thing to look at are those NAD precursors that has been talked about recently for anti-aging. There is discussion going on about supposedly it's something that's fairly uncomplicated as far as compared to stem cells and cloning and things like this, where you boost your NAD levels, which is, how do you pronounce this? It's so I get my bigger screen here. Nicotinamide adenine dinucleotide.
Nicotinamide adenine dinucleotide, right?
That's what I just said.
Yeah.
Yeah, exactly. There's buzz about this, and what's his name? Dr. Sinclair in Australia. He's talking about what he does, and I don't know a whole lot about that, but I saw another article yesterday or day before. Someone else is talking about this. I don't know if it was also David Sinclair, but talking about how he feels like his biological age has been reduced by 24 years due to this treatment that he started. He said that his father's reduced his biological age a number of years, and they're going to be entering into studies about this this formula or this. I don't know if it's and sorry I don't have more specifics, but I usually ignore this kind of stuff. But that there could be something on the market in a couple of years, because I think because a lot of it is already existing technology that's just being retooled for this existing products. So
send me that stuff, by the way. So
yeah.
I'm going to contact this guy, and I'll come back on the air, and I'll be like 24 again.
Exactly. So yeah, that's something else to look into.
George, listen, man, we're going to let you
I
go.
appreciate the update on that.
We're going to let you go and take another phone call before we call it a night. But I'm glad you are still listening. It's good to hear your voice. I'm glad you sound well, and take care of yourself in that storm.
Keep your head down, yeah.
And we're on Friday, which the time we're on Friday is 2 p.m. on the West Coast, which is 5 p.m. on the East Coast. So you can feel free to call then.
Thank you, gentlemen. Have a good evening.
All right,
I appreciate the update.
All right. Take care of yourself.
See you, buddy.
Good to hear from you.
Thanks.
888-659-3727. Our old friend George, original old school radio listener.
Exactly.
Hey, man, you're on the air. Who's this and where are you calling from? Hey, man.
Hello.
You're on.
Hey, Joe. Hey, Spencer. This is Rishi. I'm calling from San Jose.
You're calling from Paraguay?
San Jose, California.
Oh, San Jose. I thought you said you're calling from Paraguay.
That's what we said.
Yeah.
Yeah.
Well, welcome, man. Thanks for the call. What can we do for you?
Are you the one that just sent me the photos?
Yeah. So I just saw. I have no idea. Apologize if I'm asking any amateur questions. So I just saw you last night on YouTube. So I just kept on watching all the videos. So this is how I was able to talk to you right now.
Well, welcome. I'm glad you found us. I'm glad you found Joe, and I'm glad you found the show.
Yeah.
So what's up?
So yeah, I just sent an email with pictures. So I'm 24 years old. So I have been suffering from hair loss from 2 years. So I had a very thick hair. So I usually grow long to cover the thinning. So I just trimmed my hair 2 weeks back. I was just looking around the treatments. So it's very quite confusing by reading a lot of information, data, and browsing around doctors. There are tons of doctors. So I'm not ready for hair transplant yet because after seeing the videos of the surgery, it looks really scary. So I was thinking exclusively looking for PRP and the latest combinations with PRP and ACell or any other. I would like your help to know what is the best combination among those.
Look, the reality is we don't know. Everyone now is offering PRP because they jumped on the PRP bandwagon. There's only a couple of doctors that I know who seem to be getting consistent results. And, everyone is kind of using their own version of PRP or using their own types of kits. What we have learned is this. I did a video, which I don't know if Joe can guide you to, if I could find it.
Okay.
If you go to iahrs.org and scroll down, go to the podcast, and you'll find the video on PRP. And essentially, there was a small study done, which a lot of people can question because it was done in one clinic, of different PRP kits that are currently being used by different outfits. And what they found was, out of all the kits that they actually tested, there were only 2 that actually separated the plasma while, what's the word I'm looking for, sufficiently increasing the growth factors in the platelets. So most of what's being injected into people's scalp isn't real PRP. It is your blood that's being put through a centrifuge, and then the plasma being separated, but there's not enough growth factors to make a difference. So a lot of guys are using, really not PRP, but just re-injecting plasma into people's scalps and then adding ACell and saying that, this is a formula to grow hair. When in fact, what it really is, it's a formula for people to, and some of these guys are doing it unwittingly, but it's just a formula for these guys to make some money. And a lot of guys go in there, and it actually gives PRP a bad name because there's so many guys out there who are not getting results from PRP because they're not actually getting real PRP. My advice is always this. Speak to the physician and ask them, are they using an FDA-approved kit? Is it an open or closed kit? Do you have any evidence that this kit is actually creating, what amount of percentage of or increase in growth factors has this kit been producing? And can you show me the data? And anyone who can't show you that data, and is kind of taken aback by those questions, they don't know what the fuck they're doing.
Got it.
Yeah.
Also, I would like to know if I'm an ideal candidate for PRP yet, or I'm not sure if I want to go to a hair transplant so soon.
Well, let's pop up your photos on the screen here. Now, are you giving me permission to use all 3 photos? Because one of the photos has your eyes, your eyeballs visible, so we can see half of your face.
Are you giving us permission to put it on screen?
Yeah, no issues.
Okay.
Okay. All right. Here we go. So, share screen sounds. There we go. Can you hear me, Spencer?
I can hear you.
Okay. Can you hear this?
I can hear whatever you're doing.
There we go.
Yes.
Okay. All right. So, let's see. What can we see here? Back to the screen. Okay. So this is the collar.
Taken under very bright light. So usually it's a bit dark. I mean, like the hair. Yeah.
Yeah.
But that's a good. That's actually a good. I would say that seems like a pretty good representation, even from the side and the top of kind of. We can get an idea of what your hair looks like.
Yeah. So you said you've lost your hair over the course of 2 years?
2 years? Hair loss? Yeah, hair loss since 2 years, yeah.
That's pretty.
Okay, so
that's a lot of hair loss in 2 years.
This is a lot of, this is very aggressive. So my next question would logically be, how bald is your dad?
He just lost sides on the temples.
Yeah. Because someone in your family has aggressive hair loss. Who is it?
This is me before the high trim. Usually I grow it long just to cover the thinning.
Yeah, but you can't do that now.
That is me 3 weeks back.
Yeah, yeah, okay. But who in your family has aggressive hair loss?
My dad just lost on the temples, and my brother is also good. He doesn't have that much hair loss.
Okay,
even they're
uncles,
quite surprised.
grandparents, grandfathers on either side, mother's side, father's side.
Yeah, on the mother's side, yeah, my grandfather is bald.
Yeah.
Yeah.
I'm looking at your photos here, and in this photo here with where you have where you're on the beach, like this was 2 years ago.
No, just 3 weeks back.
This was 3 weeks ago?
Yeah. I know it's quite surprising. Yeah, but yes.
And then, okay.
Later I trimmed my hair to go to see a doctor and understand what procedure could be.
Okay, so that picture with your full head of... Are you watching the screen now?
Yeah, I'm watching.
Okay, so the picture... These two pictures are you, and this picture of you with a completely full mop of hair, cut longer. That's you just 3 weeks ago?
Yeah, 3 weeks ago. It's very long, so I style it with some wax.
That is a fucking trick and a half, man.
That's
You're talented.
Usually it's after I wash. I mean, like usually my hair is really thick.
Yeah. Okay.
Yeah.
I'm just kind of blown away by this artistry that you're able to pull off. How long does it take you to do this?
Yeah, I thought I was good.
30 to 40 minutes. It takes time to dry. Then yeah.
Wow.
Yeah.
Okay. Well, bravo. I'm impressed. But back to the issue. I mean, you obviously have a lot of hair loss here, a lot of miniaturization. I see.
I don't even know. I'm just being honest. I don't even know where he gets the hair from. Even if that all grew in.
Yeah, I don't.
What about the temporal region?
Yeah, that's why it's taken on a very bright light. So after some time, it gets really. I mean, like it's right now it's dark.
Like I think I feel like you're being punked, Joe.
I was just gonna say I think we're being punked.
No.
This doesn't make sense. Like you can see my mouse right now. Where does the hair here come from? When I'm looking at this and this, I do not see it.
So I usually grow very long from the sides, and I pull it. I put it in between. I comb two ways from the sides. Yeah.
Why is my? There we go. Hold on. For some reason, this is not responding. Anyway, okay. All right, so you are, you've impressed me. That's all I got to say. So looking at your hair loss, I need to ask you if you're taking any sort of medication.
No, I'm not taking it. I just use a few natural remedies like onion juice and regular hot oil massage.
Yeah, stop. You're wasting your time. This is what I recommend, okay? Go find a doctor that is go to iahrs.org, iahrs.org, and look for doctors in your area, and go talk to them. Go talk to them about finasteride, because
but I see there are certain side effects. Maybe it's basic cushion, but yeah.
Okay, I'm not going to waste your time. I'm going to tell you very simply here. Onion juice is a waste of time. Any natural remedies is a waste of time and money.
Got it.
You're completely wasting your time. Look where you are now. Okay? You've got a lot of hair loss. So they're obviously not doing anything for you. You're in a position now where you could potentially reverse your hair loss a noticeable amount, to where that magic show that you're able to put on with your hair now will be a lot easier. Instead of 40 minutes, it'll take 10.
Got it.
Okay? But wow, I'm still kind of blown away. You need to get serious about fighting your hair loss, not look to natural remedies, massaging your hair. That massaging does nothing. Don't worry about oils or anything like that. Stick with what works. Go talk to your doctor. Talk to him about finasteride. See if there is an option for topical finasteride, which can reduce side effects. But the bottom line is you need to get. Talk to your doctor. But if your doctor says get on the medication, I really suggest you get on the medication, because that's the only thing that's going to give you a chance to turn this around at all. On top of that, to a lesser degree, PRP could help, but Spencer he gave you some great advice on that. You need to tread with caution there. The potential for finasteride to work for you is far greater than PRP, simply because you don't have to worry about someone's voodoo witch's brew being different than the guy down the street. That's what it comes down to with PRP. You're showing signs of aggressive continued loss, especially being only 24 years old. Do not, for the love of God, let anyone talk you into hair transplant surgery, because it's just a bad idea. Okay? You are in a position to potentially
not go to transplant yet?
Yeah, don't do a transplant. At least for several years after you've turned your hair loss around a little bit, at the very least, with medication of some sort.
Got it.
Yeah, I can't stress that enough, man. You just don't waste your time. Finasteride, topical finasteride, maybe minoxidil down the road after finasteride works for you. Maybe PRP if you can find a reputable clinic that can show you verifiable results. But yeah, it's do or die at this point. You really don't have any options, and you have very little time to figure it out.
Got it. So I should only choose the doctors from that IHHS website?
There's several doctors.
The thing about that is, and I always want people to know this, you don't only have to choose doctors from the IHRS website. We created, we founded the IHRS to ensure that at the very least you guys have a safe place to start to do your research. There are doctors out there who are not members of the IHRS, who are ethical, who do a good job. They've just never applied to the organization. So, but for the most part, this is a group of doctors who have a collectively, strong track record, and they support our message, which is truth in advertising, telling people exactly what we're telling you. Don't waste your fucking time. Don't jump into a hair transplant. You really need to be, if you want to stop this, truly your only option, I would say, is to get on some sort of medical intervention. And like Joe described. But there are doctors who are not part of the IHRS that can guide you as well. But, you know, I think that Joe's right. You probably want to see someone who we at least knows what they're doing.
Yeah. I mean, like, I'm not punking you as I see the comments. I can share more pictures on the email again.
Yeah, and yeah, absolutely. You get back to us, let us know how things go. But I think Joe's advice is perfect. I mean, don't waste your time with all of the nonsense that. Listen, I was just in an article in the Guardian where I talked about how I used to put cayenne pepper on my scalp and hang upside down when I was your age. I mean, all kinds of crazy shit. You know what saved my hair? Finasteride or Propecia. That's what did it for me. That's what changed my life. That's why I'm behind this microphone today, and that's why I wrote my books and started my career. Now, with that said, it may not do anything for you. You may end up having side effects from it. You know, these are all possibilities that you have to go in with open eyes and know what the possibilities are. And also you also have to know what the reality is. There's a lot of misinformation online. There's a lot of fear mongering online. You have to take all the information that you read and get from the doctors and get from us, and then make a decision yourself on whether or not there's check out the risk benefit. And if you think that the slight risk is worth the possible benefit, then that's the direction you can consider going into. And we're not doctors, so we're not
the
giving
other
you,
option
we're not
is
giving
to
you
shave
medical
your head.
advice. I always say your first option is to let go.
Sure.
If you can let go, shave your head close, you've won, you've beaten baldness. Without spending a dime, without doing anything, without taking any risks, without doing what I've had to do, being on a drug for well over 2 decades. I don't know what that's going to do to me. You know? So that's the choices you have.
Sure.
All right, man?
Thanks. Yeah.
All right. So we wish you the best of luck. Follow up. Let us know what you decide to do.
Sure, definitely.
Okay, good luck.
Thanks for calling.
Then just to believe that it's not a prank.
Say it again?
What's that?
I'll just share more pictures just to believe that it's not a prank.
Okay.
No, that's okay.
That's okay.
That's okay, buddy. It's all good.
You sound genuine.
Yeah, you do.
Yeah.
Okay, man. Thank you so much for the call. Good luck. I'm glad you found the show.
Yeah, thanks a lot.
Okay, bye-bye.
Bye-bye.
Let's call it a night.
Let's do it.
Guys, sorry, who's holding on? We're not going to take any more calls. I got to get out of here. Joe Tillman's hair transplant mentor page. That is hairtransplantmentor.com, where you can learn more about Joe and his journey through hair loss, and from hair loss to...
And how I made hair transplants cool.
And how he made hair transplants cool. Because if it wasn't for Joe, hair transplants would not be cool. And the truth is, you know, I mean, I'm not saying that... I didn't like the idea, and I understood what he was saying as a compliment. I don't want anyone to think that hair transplants are cool. I want people to think that they're a viable option if you're the right candidate. You know what? You know what's really cool? Not doing anything and having the ability to do that shit. That's cool. That's cool. No
Well
offense.
said.
No offense, Joe.
That's okay.
You know, I mean, you still kind of made it cool, but we don't want to put that message out.
It was the lights behind me.
Yeah.
That's and the drone shots.
Yeah, that's actually very cool. Our website's thebaldtruth.com for archives of this broadcast. Also check out the International Alliance of Hair Restoration Surgeons. If you're considering surgery, we believe that it is a safe place to start to do your research. Look, the message of the IHRS is surgery is a last resort. Every doctor that supports our organization not only has some of the most consistent track records in the field, and in general, I mean, listen, every doctor has complaints. That's the way it is. But you are in my view, much safer hands choosing one of these doctors, on average, than going anyplace else in the world. That's just the reality of the situation. That's why they were chosen and accepted to be part of what we do. But also, they get our message and my message over the years, and that is truth in advertising, Be as honest as you possibly can. You support us telling people not to have surgery when we don't think they need it. And even to avoid it if they can. Any doctor who's willing to support that has I think a significant amount of integrity. And that's an important trait when you're dealing with this toxic, insanely dangerous industry that's only getting worse.
Yep.
The American Hair Loss Association is AmericanHairLoss.org. Bald Truth Talk is our message forum. That's baldtruthtalk.com. And Joe, you have some other sites you want to talk about?
hairlossexperiences.com, British-based forum, but being the interwebs, everyone's got access to this growing forum. They're getting more popular, good for them, and we're happy for that because the guy that runs it, he's not a mental case. He's a good guy. He likes working with us. He believes in our message. He likes supporting it, and he allows us to embed our stream twice a week, just like clockwork. So go over there and say hello and thank him for allowing us to stream this broadcast. That is hairlossexperiences.com. We also have bellycapelli.forumfree.it. It's a mouthful, but Italian usually is. The Italian-based forum, you like that? I just came up with that. The Italian-based forum, Bola, who runs that forum, he's my boy. I've known him for years. He's a good guy. As he likes to say, I'm just a guy.
Just a guy. Regular guy.
Just a guy.
Yeah.
And he is just a guy, a normal guy, another one that's not mental. We love this guy. He's a good person, great wife, and he is a hair loss sufferer as well, repair patient, if I recall. How can I forget? And they allow us to stream our broadcast through their web properties as well. And so a big thank you to bellycapelli.forumfree.it. You can see those forums on hairtransplantmentor.com/hairtransplantforums.
And don't forget Guys from Queens Network. That's guysfromqueens.com. They syndicate this program. Excuse me. Also, don't forget to subscribe to everything we've got. Go to thebaldtruth.com. Subscribe. Go to iTunes, The Bald Truth Show. Subscribe. Subscribe to Joe's channel. Ring that bell so you get notified when the show is live. Make sure you do that. Let's get this thing to well over 10,000. That is the goal. So let's make that happen. Also, everyone who's listening on iHeartRadio, iTunes Radio, Stitcher Radio, thank you so much for making The Bald Truth one of the more popular audio streams on those resources. I absolutely thank you for that and giving me the ability to get offers like I did today, even though I have to turn it down to take advertising for the program. It makes us feel like we're not only doing a good job to help, all of you guys, but that you are, hanging in there. We have what is our average listenership now? Not listenership. Our average time spent listening is something like 26 minutes or 48 minutes, I think, at one point. I mean, it's let's put it this way. The average time spent listening on radio, if you pass 15 minutes,
30 minutes and 39 seconds right now.
You are golden. And I think it's a little higher on, I have to look on the apps like iHeart and stuff.
Yeah.
You are golden. The fact that people spend more than a half an hour viewing or listening to this program is unbelievable. To bring that to radio, they wouldn't even fucking believe it. So I want to thank all of you guys for taking the time to do what you do. And I know it's not an easy subject to talk about, but find resources and ways to get the word out there because we're fighting against some really bad things that are happening to the industry. And all of your brethren are in more trouble than ever before. So if you can get this information out there, spread the word about this broadcast, spread the word about what Joe is doing independently of this broadcast, you're going to be helping a lot of people. Until next time, be strong, God bless, and thank you so much for listening.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.
I always hear a lot of guys calling in, and they're always like, down and out about their haircuts.
Sure.
I lost my hair when I was 16 to 17 years old.
That's heavy.
Oh, man, I'm sorry to hear that.
No, it's all good, man. And you know, the funny thing is that I've learned to overcome it. And I've had a much